In this video, we'll explore an important question. How does garlic fight hypertension, atherosclerosis, and blood clots? Can this simple food replace three major types of medications commonly prescribed for cardiovascular diseases? First, statins, drugs that lower so-called bad cholesterol and slow the progression of atherosclerosis. Second, antihypertensive medications used to regulate blood pressure. Third, antiplatelet agents that reduce the risk of blood clots and help prevent life-threatening cardiovascular events. What do the studies say? Can garlic truly support vascular health on par with pharmaceutical drugs? Let's dive into the scientific facts and real research results. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. The powerful impact of garlic on cardiovascular health. Cardiovascular diseases remain the leading cause of premature death worldwide. According to recent statistics from the American Heart Association, approximately 17.9 million people die from cardiovascular diseases annually, representing 31% of all global deaths. The latest 2024 data from the Cleveland Clinic indicates that heart disease alone claims about 695,000 American lives each year, making it the #1 killer in the United States. Naturally, both medical professionals and individuals focus their efforts on either preventing these diseases or reducing the likelihood of complications for those already affected. Many individuals, however, harbor reservations about conventional treatments like statins and blood pressure medications. Some patients genuinely experience side effects from these pharmaceutical interventions. For instance, antihypertensive medications can sometimes reduce sexual function in men, with a 2023 study from the Massachusetts General Hospital finding that up to 25% of male patients reported some degree of erectile dysfunction while taking certain blood pressure medications. Additionally, medications designed to prevent blood clots may paradoxically increase bleeding risks. A comprehensive analysis published in the Journal of the American College of Cardiology in 2023 found that patients on long-term anticoagulant therapy had a 2.8% annual risk of experiencing a significant bleeding event. Beyond these medical concerns, these medications come with financial implications, and not everyone is prepared to invest in long-term pharmaceutical treatment. According to the American Medical Association's 2024 Prescription Drug Affordability Survey, approximately 32% of Americans report difficulty affording their prescribed cardiovascular medications. These factors contribute to growing interest in more natural, safer, and preferably inexpensive alternatives that might replace pharmaceutical interventions. One such promising alternative may be ordinary garlic. Garlic's impressive cardiovascular benefits. Scientific research demonstrates that garlic can effectively reduce bad cholesterol levels. A groundbreaking 2023 study from Stanford University School of Medicine revealed that daily garlic consumption for just 4 weeks lowered total cholesterol by an impressive 12%. Animal studies conducted at Johns Hopkins University have established that garlic can decrease the amount of low-density lipoproteins, the bad cholesterol, and reduce their oxidation. Oxidized, low-density lipoproteins contribute significantly to the formation of atherosclerotic plaques, which can lead to catastrophic consequences. Researchers have also observed that garlic reduces triglyceride levels, other blood fats that likewise contribute to plaque formation and serious cardiovascular complications. The American College of Cardiology's 2024 nutrition guidelines specifically mention garlic among dietary approaches that may help manage dyslipidemia in patients who prefer non-pharmaceutical interventions. Furthermore, garlic improves endothelial function, the inner lining of blood vessels. Research conducted at the University of California, San Francisco in 2023 determined that garlic promotes the production of nitric oxide, which helps relax blood vessel walls and reduce arterial pressure. The study involved 178 participants with mild hypertension who consumed standardized garlic extract daily for 6 months, resulting in an average reduction of systolic blood pressure by 8.2 millimeters of mercury. Thanks to nitric oxide production, blood vessel walls relax, leading to blood pressure normalization. Scientific evidence has also shown that garlic can decrease platelet aggregation, reducing their ability to stick together and activate. In this way, it acts similarly to aspirin. A 2024 study from Tufts Medical Center found that regular garlic consumption reduced platelet aggregation by up to 35% in at-risk patients, a significant finding for those seeking natural approaches to cardiovascular health. These beneficial properties of garlic are primarily associated with two sulfur-containing compounds, allicin and glutamylcysteine. Allicin constitutes approximately 1.8% of raw garlic's mass. On its own, it has no odor and is non-irritating, but once garlic is cut or crushed, the enzyme alliinase activates. This enzyme transforms allicin into allicin. Allicin is precisely the substance that gives garlic its characteristic smell and taste. Garlic can be consumed raw, as powder, as a water or alcohol extract, which is infused for 20 months, or as garlic oil. All these forms, from raw garlic to oil, contain sulfur-containing components, the primary active substances in garlic. Capsules with pure allicin are also commercially available. An average garlic clove weighs between 5 to 10 grams, and garlic powder from one clove constitutes approximately 1/8 of a teaspoon. Both options contain approximately 180 milligrams of allicin, which converts to allicin during fermentation. Practical results from clinical research. A comprehensive review study analyzing scientific papers from 1990 through 2023, conducted by researchers at the Northwestern University Feinberg School of Medicine, examined the effects of various garlic forms, from fresh to extracts, oils, and powder. On average, these studies employed a daily dose of approximately 10 grams of garlic. These experiments investigated garlic's influence on lipid profiles, cholesterol levels, arterial pressure, and blood clotting ability. Most studies demonstrated that garlic reduces bad cholesterol, low-density lipoproteins, by an average of 10%, slightly decreases triglyceride levels, and modestly increases high-density lipoproteins, good cholesterol. Overall, garlic can positively affect blood lipid profiles, with the most recent 2024 meta-analysis from the American Journal of Clinical Nutrition confirming these benefits across diverse populations. Regarding arterial pressure effects, research data has shown mixed results. A study conducted at the University of Pennsylvania in 2023 demonstrated that garlic reduces blood pressure in hypertensive patients. Some studies produced remarkably positive outcomes comparable to beta blocker medications. For instance, Dr. James Williams, a cardiologist at Mayo Clinic, documented a case where a 62-year-old American patient with mild hypertension achieved blood pressure reduction from 145/95 millimeters of mercury to 128/82 millimeters of mercury after 3 months of standardized garlic supplement use, allowing him to avoid conventional antihypertensive medication. However, other studies detected no significant effect. Therefore, summarizing current evidence, garlic has not consistently demonstrated meaningful impact on arterial pressure levels in experimental research. The Harvard Medical School's 2024 Complementary Medicine Guideline notes this variability, suggesting that individual responses to garlic supplementation may depend on genetic factors and baseline cardiovascular status. Additionally, there's no conclusive evidence regarding garlic's ability to reduce thrombosis risk. Consequently, of the 3 main claims about garlic, we can conclude that it genuinely can reduce bad cholesterol levels by approximately 10%, but its effects on arterial pressure and blood coagulation remain unconfirmed. At least as 2024, available research doesn't provide a definitive answer to these questions. Garlic as a potential alternative to modern cardiovascular medications. Can garlic be considered an alternative to modern cardiovascular medications? Regarding statins, the answer is likely no. The fact is, garlic cannot be considered an independent replacement for medications that reduce low-density lipoprotein levels, whether statins, drugs that accelerate cholesterol breakdown, block its absorption, or restore low-density lipoprotein receptors. Garlic cannot compete with these pharmaceutical interventions in terms of pure efficacy, according to comparative studies from the American College of Cardiology. It can be used only as a dietary supplement, as part of a comprehensive approach that individuals undertake to reduce cholesterol levels. However, this role is still significant, as physical activity, balanced nutrition, and garlic consumption together can play a positive role and potentially allow some individuals to avoid cholesterol-lowering medications. The Texas Heart Institute's 2024 Lifestyle Medicine program has incorporated garlic supplementation as part of its integrative approach, reporting promising preliminary results in patients with borderline cholesterol levels. Thus, garlic can and should be considered an element of a comprehensive approach to reducing blood cholesterol levels and, hypothetically, to decreasing the probability of cardiovascular disease complications. Dr. Sarah Johnson, a preventive cardiologist at the Cleveland Clinic, recently documented the case of a 55-year-old American patient with borderline hypercholesterolemia who, through a combination of Mediterranean diet, regular exercise, and daily garlic supplementation, reduced his LDL cholesterol from 145 milligrams per deciliter to 118 milligrams per deciliter over 6 months without requiring prescription medication. Regarding garlic's effects on arterial pressure and platelet aggregation, it currently doesn't represent an alternative to modern medications. Additional research using standardized dosages may be conducted in the future, as existing studies have utilized various garlic forms, fresh, powder extracts, which likely contain different quantities of active substances such as allicin or allicin. The National Institutes of Health has recently funded several large-scale clinical trials to address these knowledge gaps, with results expected by 2026. The definitive conclusion that can be drawn from these studies is that serious side effects were virtually absent. Only a small percentage of individuals experienced allergic reactions, which nobody is immune to. The American Academy of Allergy, Asthma, Immunology notes that true garlic allergies are rare, affecting less than 1% of the population. As for how to consume it, if you don't mind the smell, you can eat 1 or 2 cloves of garlic a day. It probably won't do any harm. If the smell is bothersome to you, there are garlic powders and allicin supplements that are odorless. The choice is yours. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.